Good afternoon, everyone. My name is Robert Hess III. I am with Hess 3 Consulting, and today we're here to discuss primary, secondary, and tertiary prevention, looking at both strategies and opportunities. For those of you who this may be your first training session with us specifically, I will give you a brief history of myself. So I have about 15 years of executive experience working in behavioral health and substance use specifically, as well as I have a MPH, or actually working on it right now, finalizing that. And I've been doing consulting work for about 10 years relative to substance abuse prevention and strategic prevention framework, which is what we'll be talking about today. I've been working with various coalitions and groups across the country for quite some time and doing prevention work, again, for about 10 years. And so lots of interesting background that I hope we'll be able to draw in to today's discussion. The company does a number of different things, all relative to the strategic prevention framework and specifically the work that we're going to be talking about, but I won't bore you with that information. I want to dive directly into our learning objectives for today. So today we're going to kind of take a step back. We're going to pull all the way back to answering the question of what is prevention. And so we're going to look at primary, secondary, and tertiary prevention. And we're going to look at strategies for specific types of prevention. And then we're going to talk about Arkansas directly, because I know that's the context of the work that we're all doing. And part of this, I know that you guys have quite a robust technical assistance program. And so there's a number of different training opportunities over the next couple of months and throughout 2017 this year. And so our specific track that I will be leading, and we have a series of different trainings, they're going to be all interrelated. So I'm saying that to say that when we get to kind of discussing the specific opportunities in Arkansas, we're going to introduce some things, but they're intended to be connected to some of the subsequent training topics that we're going to be discussing over the next couple of weeks and months. And so that's my hook, line, and sinker, or my pitch to get you to come back to the next one, which we'll be having in a couple of weeks. So we're going to start by defining prevention, which sounds pretty simple, and there's a lot of different definitions, especially this term is used in a lot of different contexts. So it's used in medical context to prevent cardiovascular disease and diabetes. It's used obviously in our substance abuse prevention to prevent addiction. And there's even some work that's done to prevent mental health concerns or related mental health concerns. There's risk prevention or injury prevention. And so kind of the overarching term is defined as activities delivered prior to the onset of a disorder. These interventions are intended to prevent or reduce the risk of developing a behavioral health problem, such as underage alcohol use, prescription drug misuse, and illicit drug use. And this particular definition comes from SAMHSA. What you see at the bottom here is kind of a cycle or a scale of the continuum of care, or the process of recovery or addiction and recovery almost, or prevention and recovery. And so in our continuum, there's a lot. The very beginning first step is promotion, and that's really health promotion. So from a behavioral health and from a substance abuse prevention perspective, there's a lot of activities that happen before formal prevention. And health promotion actually does get blended into prevention work quite often and frequently, and that's totally fine. But so obviously promoting healthy lifestyles, promoting healthy decision making, there's a lot of education campaigns that help kind of focus on this. And then we see the next kind of phase here is prevention, and there's three different segments underneath it. There's universal prevention, which is defined as applying to everyone globally. And so if you think of things like the tobacco tumor causing tea staining, smelly puking habit campaign, or this is your brain on drugs, they were campaigns that were universally applied to an entire population or community. There's then selective prevention, which is focusing on specific subsets of the population. So looking at most at-risk communities. And so whether that be adolescents ages 15 to 24, if we're talking about suicide, there's a lot of work that's focused on veterans or LGBT populations or individuals with serious mental illness. Those are selected populations that we're focusing prevention on. And then there's indicated prevention. Indicated prevention, the best example is, I'll use a medical context, is if you're genetically predisposed to a particular condition that may be passed down from your parents to yourself, and whether it be a heart condition, there's some indication that you are most at risk for that for that condition. For some individuals, or at least one kind of behavioral example, is individuals that are suicide attempt survivors are most likely to reattempt suicide, or individuals that are in recovery for heroin addiction. This would be considered relapse prevention. That might be a good example for you. So then obviously we're moving into the next phase that's a little bit outside of our scope in the prevention world, but looking at treatment. And so obviously once a problem has already evolved or developed, there's case identification. So what actually is the definition of the disorder? And then of course there's a standard treatment. And of course, I'm not going into details about those because I'm not a clinician. And there's thousands of disorders we could spend all day discussing. But the next phase actually does kind of circle back into some of our efforts, and that is recovery. And we're going to talk about this a lot when we talk about tertiary prevention, but that's really the compliance with long-term treatment. And so whether that, again, for diabetes, that means monitoring your insulin. For substance users, whether it be alcoholics or someone with an alcohol use disorder, that may be going to AA meetings. But recovery looks different for everyone, especially based on the type of addiction or a specific condition that we're talking about. And there's aftercare. So again, addressing kind of the long-term effects of that condition. And so if you had a stroke and you have long-term effects or disability now, that might be something that you need to consider aftercare for. In an addiction setting, there are, of course, long-term effects of chronic meth use and heroin use. And there's all kinds of things from a physical perspective as well as psychiatric perspective to look at. And so this cycle, we're going to be talking kind of around it quite a bit. So I wanted to make sure that everyone was familiar with it. Obviously, we talk about prevention a lot. And per this kind of cycle and framework, a lot of that is focused on primary prevention. But when we start talking about secondary and tertiary prevention, some of those activities actually do bump into the treatment setting as well as the recovery setting. And we're going to really kind of focus today on pulling those things out. On the left-hand side of the screen, you'll see there's a little note that the Institute of Medicine notes that $1 invested in prevention yields $2 to $10 in savings in healthcare costs. And that's looking at criminal and juvenile justice costs, educational costs, and loss of productivity. And so the investment in prevention, obviously, that everyone on this call is probably well aware of, is exponentially better to invest that dollar into prevention versus having to then treat a condition after the fact. So what is primary prevention versus secondary prevention versus tertiary prevention? And frankly, why does it matter? So the definition of primary prevention is activities that aim to prevent disease or injury before it occurs. And we really need to emphasize the word before. This is done by preventing exposure to hazards and causes of disease and injury, altering unhealthy or unsafe behaviors that lead to disease and injury, and of course, increasing resistance to disease or injury should an exposure occur. So primary prevention within like an integrated health model looks like a lot of different things. Vaccinations are one example of how primary prevention is used to prevent you from catching the flu or the measles. In substance use, we spend a lot of time preventing exposure to substances. So whether that be through building pro-social peer circles, whether that be through Just Say No campaigns, things like that, that are really designed to, if you to prevent folks from experimenting with drugs and alcohol. And then, of course, there's altering unhealthy or unsafe behaviors that can lead to disease or injury. And so, similar to preventing exposures, really working on lifestyle changes, and whether that be among youth, again, through pro-social bonding with parents, and a lot of the strategies and activities we're going to talk about. But primary prevention, the most important thing to focus on is it is before exposure ever occurs. And so we're going to pop into our chat box, and I want to get your initial thoughts and feedback on primary prevention as a whole. Are there different definitions that you're familiar with? Are there different understandings that you might have? And we're going to spend some more time chewing on this and unpacking it, but I want to pause. And if you have specific reactions or thoughts, if you wouldn't mind typing them in the chat box for me so we can have a quick discussion. So specifically, is this, I'll ask a very simple yes and no question. Is this a definition, or does this definition resonate with your existing understanding of what primary prevention is? That can be a yes or no. So type a yes, a Y, or an N for no if this definition represents your existing understanding. Perfect, perfect, perfect. And obviously a lot of our work focuses on primary prevention. So this is absolutely what I anticipated to see, that everyone was somewhat familiar. And so what we have here are a couple of examples pulled directly from SAMHSA and the Federal Substance Abuse Block Grant, which is the funding mechanism for a lot of the work that we do. So primary prevention includes information dissemination, so providing knowledge and increasing awareness about alcohol and other drugs and addiction, education, which is really focused on skill building through the life process, or learning process, excuse me. So social skills, decision-making skills, peer resistance skills, coping with stress, problem solving. There's a lot of different curricula that are evidence-based that focus on these types of activities. Providing alternatives. And so there's a really great program called Keeping It Real that was developed out of Arizona State University that focuses on helping students or youth kind of create alternatives for providing or using substances. And there's a couple of other strategies. There's it's not a very common strategy, but I've seen it used. There's at least one organization that we'll talk about later that uses at-home drug testing kits to give youth alternatives to say no to different drugs. So they know that their parents are going to randomly and or routinely drug test them. So they obviously can't use substances. So it empowers them to say no when interacting with their peers or when they're offered. Problem identification and referral looks at identifying individuals who may be in the early stages of use. So whether that be inappropriate use of tobacco or alcohol, or have indulged in illicit drugs. This is really secondary prevention, and we're going to talk about why that is. But from the federal government's perspective and from a funding perspective, this is all rolled into a stuff that is allowable under the substance abuse block grant. And so again, these are things that you as coalitions that may be funded by these dollars, these are things that you are allowed to do and use your funding to focus on. And then there's those environmental strategies, and that's really that universal prevention that we talked about previously. Information dissemination is kind of those universal strategies. Environmental strategies focus on really changing the environment in which individuals are living their lives and making decisions. So there's a lot of work that's been done around rewriting community standards, writing city ordinances, changing state policy, changing attitudes. And the intention is really to change the environment and force change, so to speak, on how people use alcohol and other substances. So I wanted to give you guys a couple of examples of different campaigns that folks have done across the country. Some of these are specific programs that I have personally worked in. Others are programs that I am very familiar with, and others are ones that you might have seen because they're very prolific. So the Above the Influence campaign is a national kind of marketing campaign. And this is a good example of those universal strategies, as well as looking at information dissemination. So their website, abovetheinfluence.com, is a really good website that provides different interaction for, it's targeting youth specifically. And you can see they use multimedia, television commercials, internet advertising, as well as direct conversations with individuals via social media such as Facebook. And it really helps to have one-on-one interactions with youth about alcohol and other drugs. And so it's kind of, they do use peers. And so it's youth teaching youth on kind of what the risks are. So it's a safe space for them to kind of engage. Again, this is a national resource, so you guys are absolutely more than welcome to utilize this in your existing campaigns as a resource and to leverage the work that they're doing. But there's a lot of different national resources that have been done. So as a taking a quick pause, I wanted to check in and see what are the campaigns that you guys are familiar with related that are national, that are related to alcohol and substance abuse prevention. And I know there's a couple of really big ones that everyone is probably well aware of, but type some different examples in the chat box of campaigns that you're familiar with. Yeah, the Truth campaign is a fantastic one. What other big campaigns? So I mentioned it earlier, the tobacco, tumor causing, teeth staining, smelly, puking habit campaign, the This Is Your Brain on Drugs campaign. What about, I mean, there's some really popular ones. Yeah, by SOS, I'm assuming you're talking about Sources of Strength. Derek, and please clarify if that's not the one that you're referencing, but that's a great campaign. Oh, Stamp Out Smoking. Perfect. So Sources of Strength is another one. Yeah. Historically, there was the DARE campaign that I know everyone it was very popular in the 90s. Even Mothers Against Destructive Decisions, and Students Against Destructive Decisions. There's quite a bit of good educational campaigns that have been developed. Now, just as I probably shouldn't go on this tangent, but I will. I'm sure many of you guys have heard, that the DARE campaign was found to not actually change student behavior. So it's found to not be evidence-based. And that was based off of the outcomes that they were tracking. So the intention of the DARE campaign was to actually change student behavior. And we're going to have a whole session on outcomes and knowing what you're tracking and how to tell your story and stuff like that. And that was really the flaw of the DARE campaign, is they were measuring the wrong thing. If they would have been focusing on increase in knowledge or impact and social reach and really focusing on information dissemination as opposed to behavior change, then I would argue, and I've not seen the data, but I would argue that they probably would have been very effective or seen as very effective at least achieving that, at educating youth around the risks of substance use. And so that's a fun lesson in focusing your outcomes specifically and making sure that you're tracking the right things. Another campaign that you may be familiar with, or I'm sorry, you're probably not familiar with, this was in a very rural community out in Maricopa County, Arizona. And what they have done in 2010, they were a local coalition that started, and they were able to get city ordinances passed that required it was called a social host ordinance. And so the social host ordinance basically held parents and families accountable if they were found to be allowing youth to drink, smoke, or use drugs at their house. And so one thing that a lot of parents, we've heard this many times, that parents are like, well, as long as it's at my house, I'm okay with it. Or as long as, they're doing it in my supervision, then it's not a big deal. And families and parents would even like collect car keys and then open their bar for a bunch of 16 and 17-year-olds and allow them to get intoxicated and use drugs and everything in their house because they felt like they it was acceptable as long as they were there to supervise and ensure safety. And essentially this social host ordinance stopped that and allowed parents to be prosecuted for doing that, as well as it increased the number of police doing party patrols in the evenings in rural or in residential areas where they're like, especially around high schools, where they were known to be doing a lot of these types of activities. And so after several years, they were able to track outcomes, and the number of police calls to houses that where there were adolescents partying had really dramatically dropped, as well as of course, there were families and parents that had been fined and prosecuted. So it's just an interesting example of an environmental strategy that had been assigned or had been leveraged within a particular community. And I'm going to keep going just because of time. I'm a little bit behind. So another good example of primary prevention is this organization called Not My Kid. This is an organization I actually used to work for, so I'm very familiar with what they do. They would take students or young adults that were in recovery, and they would then build relationships with middle schools and high schools in the state of Arizona again. And they would go into middle schools and high schools and have peers share their stories. So it is really an information dissemination campaign, but it was very effective. And so to date, they've been around, I guess, oh wow, almost 20 years now. But to date, they have reached an estimated 1.2 million students in Arizona alone, faculty and family members as well, using their peer education model. And so essentially, again, they would raise awareness about these issues, talk about consequences of substance use, and then faculty and parents were also trained or are also trained on identifying signs and symptoms of substance use. And then there's intervention work to be done. So they work with student resource officers. They have a whole cadre of therapists and folks that they refer students to. There's a number of different activities that they do that if a student is in need of help, that they then connect them to those services and resources to help them get into recovery. And it is a sizable project that has been very successful over the years. And for those of you that have heard a number of training sessions with me, I've talked about them quite extensively. So I definitely recommend taking a look at some of their work because it's very unique and very effective. So we're going to move on to secondary prevention. And a lot of our work in substance prevention in our coalitions and using the strategic prevention framework does focus on primary prevention. So I'm offering a review of secondary and tertiary prevention for a couple of reasons. One, I want us to be able to draw the line in the sand, so to speak, on what the differences are. And also, I want us to see that there are also opportunities to continue our work and build connections to other systems, whether that be treatment and or recovery systems, for us to kind of move beyond just our typical primary prevention work. There are other opportunities for us. And so by definition, secondary prevention aims to reduce the impact of a disease or injury that has already occurred. And so if we were to flip back a couple of slides, and we are talking about early identification or screening for substance abuse conditions, those conditions have already started. So the youth have already started smoking cigarettes or already started drinking alcohol or already have tried marijuana, whatever the substance is, they've already done it. And so technically this early identification piece falls into secondary prevention. This is done by detecting and treating disease or injury as soon as possible to halt or slow its progress, encouraging personal strategies to prevent re-injury or reoccurrence, and of course implementing programs to return people to their original health and function to prevent long-term problems. So some of the work, like I described, that Not My Kid was doing around training faculty and teachers about early warning signs and symptoms of substance use, all of that technically falls into the secondary prevention category because the youth are already using substances at the time that we're identifying signs and symptoms. There are other practices or things that I've seen done that have been effective in this area. Are also those random in-home drug testing kits and different things that, again, are going to help identify that a problem already exists. So I want to pause one more time and see if there are any examples. Well, let me ask this question first. On the left-hand side, so we see, how does secondary prevention differ from primary prevention in your work? So I want to hear a little bit about the activities and work that you guys are doing on the ground. And please feel free, if you would like to unmute, and if you have a microphone and want to speak, I would very gladly unmute you and let you, and want to hear your thoughts. Or if you want to chat or type them in the chat box, I would love to hear some examples of maybe how you're using secondary prevention in your existing work today compared to primary prevention. And this is a test, so I want to see at least one person share for me, if you guys don't mind. All right. So I'm not seeing any typing. So again, I think that the example, I'll just use that organization again. So with Not My Kid, the primary prevention activities would be the sharing of student stories or individual stories to prevent experimenting or use of substances, whereas secondary prevention would be kind of the faculty and parent education to help identify early warning signs. And Michael, thank you so much. So I see that you go to neighborhood watch meetings and do drug impairment education sessions. Yeah, and second chance programs. We'll actually talk about second chance programs. So depending on how you define them and what they do, second chance programs typically are individuals that have already offended. And so and by offended, I mean typically they've gone to court and been tried or found guilty of, possession or intent to distribute or some type of legal infraction. And then they're put into the equivalent of a recovery program or a support group or something, as opposed to being sent to juvenile detention or jail. So if that's not what you're talking about, then please tell me more. But that may fit better into tertiary prevention as well. So secondary prevention is really about identifying it and treating it as soon as possible. And it gets kind of into shades of gray and some nuances. But yeah, reviewing treatment data to focus prevention work, so really understanding what those needs are. That is an excellent example of kind of a systems level approach. Perfect. All right, so let's keep chugging along. So some of the strategies, and here we go, that we see are regular exams and screening tests. And so hopefully everyone on this call goes and gets their annual physical. I'm a big advocate for preventative healthcare. And an annual physical is an example of secondary prevention. It's designed to identify a problem early in the process or before it starts. And so, in that physical, you're going to have to do certain things to stretch and show that you're in good health. Part of that could be a behavioral health or substance use screening at a primary care physician's office. That's what PCP stands for. And so if you're able to identify that someone is, starting to drink more a week than they typically would, or you have a 13-year-old who's saying, yeah, I drank 5 times in the last 30 days, those would be opportunities to be a screening to identify a problem before it gets to full-on addiction. And there's lots of examples there. Training parents and faculty on signs and symptoms, we kind of already talked about that. Quitting smoking and or drinking now to prevent kind of lung or liver disease. So this wouldn't be secondary prevention for substance use. It'd be secondary prevention for liver and lung disease, if that makes sense, because they may already have an addiction issue, but we're trying to prevent or reduce the risk for other conditions. Harm reduction campaigns, treatment as prevention of HIV. That might be a little bit out of the scope of some of the work that we're used to doing. But today, HIV has evolved quite dramatically. And so for individuals that are receiving the recommended treatment, they actually are able to reduce the possibility of transmission. So it is actually now, if you can get your viral load down low enough, then you'll go undetectable and you will not be able to transmit the disease to another individual, as well as you're reducing the harmful impacts of the disease on your own life, indefinitely, so to speak. So treatment can be a form of prevention, but like I said, it's a little outside the norm of what we may be used to from a strictly substance abuse model. Um, Naloxone, which is an opioid overdose program, and we're going to talk about that actually in a second as one of our case studies, so I'll save it. But that is another way to reduce the harmful effects of an overdose. You can actually literally save people's lives. It's great. And then medication-assisted treatment, so detoxification, is another way where again you would be preventing the negative consequences of addiction by providing a medical treatment to help them detox. So by lessening kind of their struggle or pain in the detox process, it is a form of prevention. It's pretty abstract, and I think most people would see that as a form of treatment. But kind of conceptually, you can think about that as a form of secondary prevention. So I wanted to provide you some examples of secondary prevention, and I'm going to describe that naloxone program because I think it's really interesting, and I frankly just learned about it a couple of months ago. So the Maryland Department of Health and Mental Hygiene is kind of a national leader in this, and they have a program called the Overdose Response Program. Essentially what they do, so naloxone is a medication that will prevent or stop someone from overdosing. This is really kind of an emergency response. It's kind of like an EpiPen, almost identical to an EpiPen. But so of course, the problem is you have to find someone in the middle of an allergic reaction in order for an EpiPen to work, right? It's not helpful if you have to wait 5 days to get into a doctor's appointment when you're having an anaphylactic reaction, to eating peanuts. So similarly, the naloxone works exactly like an EpiPen, but you literally have to find someone in the middle of an overdose. And so similar to how, people with allergies and anaphylactic allergies are prescribed EpiPens to hold on to and carry with them, the city of Baltimore the state of Maryland, but the city of Baltimore as well, has created a program to train individuals to recognize and respond to overdoses. And so whether that be someone walking down the street and you see someone who may be overdosing, or more specifically, and the most common application is for EMS providers, so your paramedics and police officers, emergency department docs, and individuals that are typically your first responders, they have all been trained on how to recognize the signs of an overdose, and then they have been handed the prescription naloxone. And similarly, like I said, it does look like an EpiPen, and there's a specific way it needs to be administered. But if you were to get a phone call that someone were overdosing, or if you were to be walking down the street late at night and you see someone who may be overdosing and you happen to have this with you, it actually will stop the overdose and will save their life. And so this is an example of secondary prevention because you are reducing the harm of the overdose. So you're reducing the negative impacts of an individual overdosing. I've not seen, I'm going to be very honest, I've not yet seen a prevention coalition and or substance abuse block grant dollars used to fund this type of program. This is kind of an innovative pilot, I would say. Nationally, they're getting a lot of attention for it, but I've not seen this rolled out on a larger scale. But I wanted to offer it kind of as an out-of-the-box creative way for us to think about how prevention might be implemented and start thinking about these things a little bit differently. So I hope that you guys are able to see the connections here and that I'm not, being too abstract or too out of the box, but we'll keep talking about that. So tertiary prevention is really after the fact. This is really kind of that recovery focus or rehabilitation. And so tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effects. So this is done by helping people manage long-term, often complex health problems and injuries, chronic diseases, permanent impairments, in order to improve as much as possible their ability to function, the quality of life, or their life expectancy. And so if you think about someone who may have smoked all of their life and now has COPD, chronic obstructive pulmonary disease, all of the treatment that's provided to help them, like whether that be inhalers or other type of pulmonary treatments, steroids, medical treatment, all of that is classified as tertiary prevention because it's reducing the impact. It's reducing their pain. It's reducing their it's hopefully increasing their ability to function and still be able to live active daily lives. For us, from a social and behavioral context, we would really think about recovery groups, support groups, pro-social bonding, opportunities to help individuals that may have experienced addiction, but now they're looking to rehabilitate and or integrate back into society. And so some of the strategies that are used are support groups, like we talked about, not just for the individuals that are recovering from addiction, but their family members. So using Al-Anon and or family supports. Rehabilitation groups, shelter and housing could be an example, sober living projects, because again, these individuals, their addiction, and I'm sure you guys are all very familiar with this, but addiction often, burns natural resources and support, so they may not be able to go back and live with their families, as well as they may need a sober living environment that's not a residential treatment facility, but they need a place where and there's a meeting on site, there's people that are also in recovery, supporting their process, etc. Depending on the length of their addiction, vocational and educational programs to assist with reintegration or employment, so job skills development. Methadone treatment, again, often used with heroin addicts, and can help them chemically and biophysically kind of recover and be able to function in society. Pro-social activities, which is something that is funded by substance abuse block grants. So creating positive relationships and opportunities. I think a lot of this stems naturally out of support groups as a convening resource, but there are also other opportunities to create kind of like sober social activities. And then, of course, medical treatment for liver disease, lung disease, HIV, hepatitis. And again, we probably wouldn't think about those as being connected to our work today. But when you imagine someone who is a chronic alcoholic or someone who, again, was a chronic smoker or whatever that may have been, they're going to have these other medical conditions related to their substance use and or addiction. Of course, for injective drug users, they're going to be exposed to HIV, hepatitis, and a number of other things that may become chronic conditions for them to consider. So thinking abstractly or kind of out of the box, again, there may be some opportunities to connect resources with some of these organizations to help us get better. Do a better job at serving, substance using populations for prevention, as well as primary, secondary, and tertiary prevention. I'm offering this case study as an interesting model. I want to note that this case study is not evidence-based, so please don't, take this and run with it. But I thought it was interesting from a way to think about tertiary prevention and how we might be doing our work today. So similar to your second chance program that was talked about, there's a specific program called STAR, so the Substance Abuse Reentry Program, that is used at juvenile offenders who've been incarcerated for substance use. And so the goal of this program is to offer wraparound services, which includes case management, job training, GED and high school programming, mental health counseling, parenting classes, tattoo removal. I've seen similar models used that include like foster care and parent supports or therapeutic foster care, et cetera, depending on how, kind of what the status of these juveniles may be. But really helping them re-enter from a juvenile correction facility back into society. So this particular program, the STAR program, you'll see 70% of participants reported still being employed, and self-reported arrests were less than 15% or had reduced by 15% at 12 months. However, abstinence from substance abuse did not change. So there are positive effects of this program. The intended effect was to help people abstain from substances, which it was not successful at. So again, it's a non-evidence-based program for substance abuse. But I have seen evidence-based programs that are similar. They've just not been rigorously evaluated. So, but thinking about ways that tertiary prevention, essentially preventing relapse, as well as helping people stay sober and in recovery, are also things that could fall within kind of the domain. Awesome. So I'm looking in the chat box, and Chucks, it looks like you shared some information about overdose prevention called Prescription Drug Overdose Grant, and Arkansas does have funding for that. So hopefully you'll be able to share some resources with the group so folks can kind of take a look at that. And so, Derek, I'm looking at your question around 12-step programs for alcoholics. Would that be considered tertiary prevention? Yes. Formally, it would be considered tertiary prevention because, again, it's helping people reduce the long-term impacts of addiction. And from a social behavioral perspective, I think if you've never been to a 12-step meeting, I highly recommend you go. I love them. It's a great opportunity to build not just abstinence or sobriety skills, but as well as a new social support system and network that's positive and pro-social. And so there's quite a bit of work that can be done there. And Lorraine's sharing that there's also some funding focusing on mental health youth and wraparound training. And so the wraparound approach is used very, very frequently all across the country, looking at a children's system of care model. And it's a little outside the scope of what we're talking about today. But if you guys are really interested in maybe learning a little bit more about that, I can talk with Lorraine and Chucks and the team to see if we want to add a session on that topic or something, because I've done a lot of work with the children's system of care, both at the federal level with SAMHSA as well as with a number of different states and counties and different systems to help build that. So there's a lot of promising work that can be done there. And I think from our perspective, there's a lot of opportunities for collaboration to really help create linkages, as well as leverage some of their resources from a funding perspective to help reinforce our prevention activities. So there's quite a bit of stuff going on in Arkansas, and I'm really going to ask that, Lorraine, Chucks, the team, Derek, and any of the coalitions, I really, really hope will become a robust discussion because I do not live in Arkansas, nor do I work for the state. So I took some time to look at the substance abuse block grant that currently exists in Arkansas. And I've extracted a couple of the goals and a couple of the things that were listed in there. And the purpose behind this is to help kind of connect for some of the coalitions and some of the folks that are working on the ground to help make sure that you get an opportunity to see kind of what the state's priorities are so that you can then take some time to consider what your current activities are, what your current focuses are. And in my experience, I'm going to try and word this softly and correctly. In my experience, there's a lot of added value in aligning your work on the ground with the stated priorities from your leadership, and whether that be the stated federal priorities, whether that be the stated statewide priorities or the stated local priorities. And so essentially, if the feds and the state and your local county are all saying we're going left, and you are saying, oh, but I want to go right, I feel really strongly about turning right at this road, it's going to be very difficult to rein in all those folks and get them to see your direction. And that's not to excuse or negate moments of advocacy and the need for community awareness and public voice. But it's just as an opportunity for us to align strategies where that's possible. So continue to advocate for the needs in your local community that may not be represented in these kind of initiatives, but also see where you can leverage kind of the state and national priorities to benefit your local community. And I hope that that's being said in a way that makes sense because I've had to work in lots of big systems. And so sometimes you have to make sure that there's alignment whenever possible. So according to Arkansas's current substance abuse block grant, some of the priorities include increasing the public awareness of FASD, its consequences, and that it is preventable, along with increased educator understanding of signs and symptoms, fetal alcohol syndrome disorder, Expanding youth efforts for leadership and advocacy by increasing knowledge and skills involved in prevention and community mobilization so that youth will become recognized advocates for themselves and peers. Developing curricula and the training for trainers on topics centered on collaboration, community mobilization, and community requested topics. Coordinated services for veterans, families, and others impacted by war to determine and fill gaps based on issues, geography, age, and gender. We're going to go through a couple more of these, but I do want to stop and pause. And I want to talk locally about what's happening in Arkansas. So this is where I need you guys to chime in for me. What are some of the innovative prevention activities? And maybe Lorraine and Chucks and Derek, you might be the best to respond to this. But what are some of the innovative activities that are happening across the state? So if you're in a local coalition, please feel free to jot down or type in some ideas. Or again, if you're kind of up at the state level and you've seen some really cool stuff that you think is really effective, please offer something in the chat box that we can all learn from. Assuming folks are probably typing. Yeah, so some of the community coalition activities, what specifically? I want to kind of hear some of those very specific, innovative activities. The prescription drug take back program. Yeah, that's a fantastic program. I've seen that rolled out in a couple of different states. It's a really exciting opportunity. Yeah, reentry programs, that's fantastic. And so we're seeing, an advisory board within school districts. Wow, that's cool. I've not seen a lot of school districts do that. That's fantastic. There's a lot of really creative ways for us to get involved. I think one thing, just a personal opinion, I think that partnering with schools remains a hugely untapped resource across the country. I've started to see it being done a little bit more, but schools literally house your target audience for 40 hours a week or 30 hours a week. And there's a lot of opportunity to help create better environments that are more preventative focused. So I think that's great. And of course, collecting data and using that data then to craft information messages and help raise awareness about the local issues. All of that is really important and very good examples. So I'm going to keep us moving along. So additional things that are in the statewide strategy: expand efforts for youth leadership and advocacy by increasing knowledge and skills involved in prevention and community mobilization so that youth can become recognized advocates for themselves and their peers. We want to restructure current technical assistance systems to focus on local community training and parent education, incorporate integrated services and cross-training and workforce development, provide local funding to leverage direct services to the community, coordinate efforts between the Tobacco Control Board, the Beverage Control Board, and DBHS for joint merchant education, continue and enhance efforts by the State Drug Director's Office, Rotary, and law enforcement to raise community awareness through Monitor, Secure, and Dispose campaign. And I think it's supposed to say biennial drug takebacks. And so I hope that your wheels are turning a little bit with some of these strategies. Is everyone, type a Y in the chat box if these are things that you're very familiar with. And type an N in the chat box if they're things that are newer to you or maybe you weren't aware that the state was focusing on. Good. Lots of Ys. Yeah. So perfect. I'm glad that there are some ends here because this is the critical opportunity for you guys to really start thinking about, and I think we have one more slide to go through as well of other strategies, but to think through, kind of where the state is headed and start thinking about your own current primary, secondary, and tertiary prevention activities, depending on where in the system you are. And I recognize that folks that participate in this webinar are not always part of a community-based coalition. That there are treatment providers, we've had faculty from different educational institutions and foster parents. We get a wide catchment of participants in these trainings. So, thinking about where some of those activities could be translated to your local community. And so the last slide of kind of strategies from the state's plan is to provide training about prevention to physicians and other healthcare providers for greater understanding about the science of addiction and prescription drug use issues and overprescribing, which is a really critical component. Provide training about prevention of law enforcement, especially school resource officers, for better understanding of youth drug trends, behaviors, and appropriate environmental prevention strategies. This one I thought was interesting. Provide training about prevention to physical education and health teachers who are primarily responsible for substance abuse prevention in classrooms. I think that these last activities really help exemplify some of the targeted people to engage. So we're talking about physicians, we're talking about law enforcement, we're talking about student resource officers, the physical education and health teachers, really getting down to where those partnerships should exactly align. And you can see kind of this question. This is rhetorical. You don't have to answer this one, but think about how you can better align your individual activities, your coalition's activities, or your organization's activities with the state's stated priorities. And that's really, I know I've spent a lot of time on this, but I can't emphasize that enough, because strategically that's going to really open you up to a lot of opportunities. And then we have our last slide. I'm just throwing this out here kind of as a carrot, or hopefully to perk your interest a little bit. So in 2012, Arkansas received $86.1 million in federal grants that are focused to reduce the availability and misuse of drugs. Now, I'm hoping that that number is perceived to be very large because it is. And if you look really, really closely, and I don't know that we really can do that, I have a link to this spreadsheet on the next slide, so you'll be able to look it up. But there's a list of all of the different types of funding that are focused, or that the federal government perceives to help reduce the availability and misuse of drugs, which is prevention. And there's things in here: the Department of Agriculture, the Department of Education, obviously the Department of Health and Human Services, but child welfare, of course, Medicaid has some funding, the Substance Abuse Block Grant, which is probably what we're most familiar with, Department of Housing and Urban Development, the Department of Justice, Department of Transportation, Veterans Administration, and the Executive Office of the President also provides funding to the Office of National Drug Control, which has some things specific in the state. So I'm offering this, and again, we're going to talk about funding and financing and sustainability in a subsequent training. But as we're thinking about what is prevention, and we're thinking about what is primary prevention versus what is secondary prevention versus what is tertiary prevention, and how can we as prevention professionals better align our activities with kind of national and state priorities, I think we need to understand what those national and state priorities are, which I think we've covered. But then we also need to understand where that funding exists for us to create better linkages and or better leverage resources that are not exclusive to the funding that we're currently receiving to do our current activities. So hopefully this is intended to help expand the scope of how we're thinking about things. And you can see on the left-hand side, or the right-hand side here, excuse me, it's just another rhetorical question around how we can start creating additional partnerships to leverage these additional funding streams to support our work. And of course, outside of just these federal dollars, there are private foundations, there are corporate sponsors, there are individual donors, there's a lot of other folks that are invested in this work, and we just need to start thinking about how we can create those linkages a little bit more abstractly. So we're coming to the close, and we have just a couple of minutes. I wanted to make sure that you had these resources, so you'll see the third resource on here, the White House Drug Control Update for Arkansas, that's where that spreadsheet is located. That's a fairly large document, but I highly recommend you take a look at it. And then there's a couple of other resources that are there. But this is really just to give you some stuff to start chewing on, so that as we continue our series over the next couple of weeks, then you'll be able to take advantage of or kind of build upon this conversation. And so the last slide that's always very important is our call or ask that you complete a survey for us. Now, I have to apologize. The previous survey we were using expired, and I'm not able to get back to it. So this survey link is not as user-friendly. The previous one just said UALR surveymonkey.com/UALR training. Unfortunately, this one's a little more complicated. And so I'm going to type it into the chat box for you. And if you would please go ahead and complete this survey, then we'll be able to give you credit for today's session. So you can go ahead and do that right now. I'm going to hang out for a couple minutes for any questions that any folks might have, any thoughts, comments, anything that's burning or jumping out at you. Lorraine commented about transcripts, so please pay attention to your emails. We'll make sure that you get those. But any final questions or thoughts before we wrap up today? All right. Well, I definitely love to hear feedback, so please use that survey and the comment section to provide feedback on the content for today, anything that was missed that you wish we would have covered, additional topics that may have stimulated based off of this conversation today. We definitely want to make sure that we're crafting subsequent trainings towards specifically what it is that you're looking for and what your needs are. So please feel free to give us as much info as possible. And with that, I will bid you adieu. I hope you guys all have a great afternoon, and I will see you back in, I think, about 2 weeks or so for our next session. And there'll probably be some information going out to register for that. Thank you, guys.